I'm going to treat this as a separate meeting, although we did have a public meeting, went from 10 to about 11:40 this morning. The meeting is this meeting of the Pennsylvania Opioid Misuse and Addiction Abatement Trust has been duly advertised as a public meeting in accordance with the Sunshine Act and is therefore open to members of the public and observers. Participation in this meeting is limited to trustees and those members of the public that registered in advance to participate. Meeting is being recorded and minutes from this meeting will be available on the trust website after they're approved by the Board of Trustees. This is the first time we're having a public listening session. It's been asked for. We're happy to have it. We value the input that we're about to receive over the next hour and a half. And I'm very glad for all of the participants who are making themselves available to do it. I think I would like to have a call the roll, although we don't need a quorum officially to have this meeting. I think it would be good for the public to see how many trustees are participating in the meeting and are interested in what they have to say.
Okay. Tamar Alexander.
Good afternoon, everyone present.
Commissioner Kevin Boozle. Present. Secretary Letitia Davis-Jones.
Present.
Commissioner Patrick Fabian.
Present.
Stuart Fisk.
Present.
Representative Jamie Flick.
Afternoon from Williamsport, home of the Little League World Series. Thank you for tuning in.
Representative Danielle Friel-Auden.
This is her Chief of Staff, present on her behalf. Beth Brindle.
Jay Madden. Present. Commissioner Robert Postal.
Present.
Senator Dawn Keefer. Senator Christine Tartaglione.
Senator Dawn Kiefer is having some technical issues, but she'll be logging on shortly.
Thank you. Chair Tom Baker.
Okay, thank you. And Senator Tartaglione is going to try to be on. She's unfortunately attending a funeral of her 35-year-old staff. She's not able to. Really was looking forward to it. The Sunshine Act, which does govern what we do, does not mandate public participation at the meetings of the trust. But we still recognize the value of engaging with the community members to gather diverse perspectives on the issues that are confronting the trust. The issues under consideration by the trust, we realize have significant implications for the community, and the board seeks to provide a platform where individuals can express their concerns and suggestions. We do have guidelines for this. Everything is trial and error. We are 3 years old now, but have been learning a lot about everything. But this will be the first meeting where we've allowed public comments. So we do have some guidelines that we wanted to establish. Doesn't mean they can't change in subsequent meetings, but we are going to allow each speaker 5 minutes to address the trust. The session will be for the purpose of allowing you to comment and will not include dialogue with or answers or responses from the trustees. We want to speak as one group so that to the extent we've should be answered, that we should provide comment to, the trust will meet and we will provide an answer to those of you that were good enough to be interested enough to ask the question. And we will also post it on our website so that everybody can know what you raised and what our response to it is, if it calls for a response. As I said, it is a public listening session. We did require registration for this. Originally, 17 people had registered within the time frame that we allowed. We did have a subsequent reaffirmation of the fact that people were going to speak and required people to respond to us in order to confirm their speaking engagement. Only 10 people responded, so we are going to have 10 speakers and be limited to 10 speakers. We do have 4 members, I understand, that are going to be present in person. We will go with them first. The remainder will be by Zoom. We are going to try to go as much as we can in the order in which we have responses and and speak. There is one exception to taking them in that order, and that is that Kathleen Strain, who would have been speaking a little bit earlier, we put at the end of the group because she has a previous engagement dealing with Fentanyl Awareness Day. And we agreed to push her to the end, and so that we can make sure she has the opportunity to get on and be heard. I said we're going to limit this to 5 minutes. I'll try to give you a signal when you have 1 minute left for those in the room. And we'll try to give whatever notification we can to those that are on Zoom. But once again, if you see me raise my hand, if you can be picturing me while you're speaking, that means you have 1 minute, 1 minute left. And we value your input. And with that, why don't we get started? And our first speaker will be Andrew Capone. I would like to ask each speaker that comes to the podium to state their name and if they represent any organization, who they represent, and what they're here on behalf of.
Thank you.
Andrew?
Good afternoon, everyone, trustees. Thank you for allowing me to speak here today. My name is Andrew Capone. I'm an attorney with the Public Defender Association of Pennsylvania. Public defenders are uniquely positioned to serve people suffering from opioid use disorder in Pennsylvania. I'm here to ask you to remove the frequently asked question on your website indicating that settlement funds cannot be used to fund public defenders, as it is not considered an abatement strategy. This frequently asked question has a chilling effect. It deters counties from even trying to apply for funding for public defender offices. As I mentioned when I introduced myself, my name is Andrew Capone, and I work for the Public Defender Association of Pennsylvania. My responsibilities now include working with every public defender's office across our Commonwealth. However, before I did that, I worked as an attorney for the Allegheny County Public Defender's Office in Pittsburgh for 12 years. That is how I know that public defenders are uniquely positioned to serve people suffering from opioid use disorder in Pennsylvania. For 12 years, I saw the intersection between opioid use disorder and the criminal legal system involvement every day. It was devastating. People addicted to opioids cycled in and out of jails, criminals, and sentenced to fines and probations that made the barriers to recovery even greater. Recognizing this and wanting to find a way to mitigate the devastation, Alina Chulik, the program manager of Project Rehabilitate in Allegheny County at their public defender's office, and I went to an inpatient rehab facility at Gateway Aliquippa. We didn't have much of a plan, but we knew as public defenders that we were in a position where we could help. So Alina and I showed up to that rehab facility and asked the staff if we could offer our services to any patient that would be interested in speaking with us. We didn't know how many patients to expect, how we could help them, or how long we would be there. The staff welcomed us with excitement. They set us up in a small basement office and compiled a list of everyone who would want to speak with us that day. On that day, of the 80 patients in that inpatient rehabilitation facility, 50 came to speak with us. Every one of them had criminal legal system involvement. Some had active warrants for their arrest, some had criminal charges pending. All of them were terrified that the recovery would be derailed by arrest or incarceration. That day, we met a man named Anderson. Anderson had an active criminal case and a warrant for his arrest. He had non-traffic warrants for costs and fines. Involvement was a huge roadblock to his recovery from opioid use disorder. He was afraid that if he told anyone about his charges, he would be either kicked out of the rehab facility or arrested and incarcerated. He was afraid that even if he did complete the rehab program, once he was done, he would never be able to pay off the cost of his outstanding warrants. Criminal legal system involvement weighed so heavily on Anderson that it crushed any hope he had of a recovery. This demonstrates why public defenders are uniquely positioned to provide services to people like Anderson. The conversations between Anderson and I are protected by attorney-client privilege. I was able to identify his legal needs and help him find solutions without putting him in fear or risk of incarceration. As a public defender, I knew exactly what to do. I contacted pretrial services, asked him to agree to clear his warrants as long as he completed the treatment program. I created a case file for him and assigned a defender attorney to represent him. I contacted the magisterial district judges that he owed outstanding fines and costs to and asked them to determine that he was unable to pay those fines and provide credit for time served. It wasn't just Anderson that day. We met with 50 other patients in that facility. Every single one of them needed services to mitigate the destruction of the criminal legal system. Alina and I were at that rehabilitation facility. So much need. Well, there was so much need, in fact, they asked us to come back next week and do it all over again. And they asked us to come back to 3 additional facilities in the area to provide the same service. But that was the problem. We couldn't do it. We didn't have the capacity or the resources. I was a public defender attorney with 100 clients, most of whom were incarcerated, all who needed immediate attention. If I shifted my attention to those in the rehab facility, I wouldn't be able to represent my clients. I spent that evening, that whole week, the evenings, writing motions, writing letters, and providing services. Eventually, Anderson's outstanding fines and costs were eliminated. His criminal warrant was lifted, he was given a new court date, he completed treatment, and he was assigned a public defender attorney. The barriers presented by the risk of incarceration and the weight of outstanding fines and the uncertainty of the criminal legal system were all lifted. He completed inpatient treatment, transitioned to a halfway house, and several months later, at his next court date, he was clean, happy, and on the road to recovery.
Andrew, that is the 5 minutes. If you could wrap it up, please.
Yes. It's the attorney-client relationship and public defender understanding and involvement in the workings of the criminal legal system that make public defenders uniquely positioned to represent clients suffering from opioid use. Asking that you remove the frequently asked question on your website indicating that settlement funds cannot be used for public defenders, as is not considered an abatement strategy, as this deters counties from even trying to apply for funding from public defenders offices.
Thank you very much. Thank you in your position. Next, we will have, I would like to note that Senator Kiefer has joined the meeting, so she is one of our newer members, but is interested in everything you have to say. Next up is Eric Olsey. I understand is here in person. Eric?
Yeah, thank you.
Thank you.
Again, like the prior speaker, thank you for the opportunity to provide this testimony and thank you for the work of the trust for what you do. My name is Eric Hulsey. I'm the executive director of an organization based in Pittsburgh called the Institute for Research, Education, and Training in Addictions, whose mission is to help people respond effectively to substance use and related problems. Prior to that, I was serving in a role working with many attorney general's offices and entities like this trust, county behavioral health offices, state departments of health and human services, all in the management and administration of opioid settlement funds in alignment with the opioid settlement principles, which I is pleased to see that on the website of the trust that resources listed there. I also led the development of a tool called OSPRI, the Opioid Settlement Principles Resource and Indicators, which was designed, what we had discovered is a lot of the counties and states and entities were having a challenge in implementing evidence-based or effective practices. So we tried to give them a tool to help implement those and adopt those opioid settlement principles. So definitely strategies and demonstrate to their constituents, their public, how their investments, while keeping our eye on the prize, a lot of people have suffered and died, and to keep the eye on the prize on how their decisions have resulted in alleviating suffering and reducing overdose risk in their community. I've worked with these folks, helping them identify plans, identify what their needs are, and using this tool to help them to adopt these opioid settlement principles. And through this work, I have become connected to a bunch of national networks and, serve on one of them with a couple of folks in this room. And it all with the intention of trying to adopt and implement these effective practices and these settlement principles. Part of these materials came from, we know the challenges counties experience in trying to interpret what's in Exhibit E, interpreting that verbatim or what the intention or the spirit was when they originally designed it, several years ago, which was a pretty good job. But the times change, the drugs change, the risks change, and the interventions change. And I know also the challenges that entities like this have with the responsibility of interpreting that and making decisions, as you all have, as we witnessed earlier today. So, you know, now that I'm working in mine and, in the Commonwealth, my home state, I just wanted to make myself available, to the trust or any of the counties who are interested in using these tools and decision support tools like this, or connecting with folks in the record, pointing people into the direction where some of these templates and tools and reporting for accountability, where this exists. I just wanted to, share that just in this testimony to make myself available. So, thank you for the opportunity.
Well, thank you, and I'm sure we'll avail ourselves of the opportunity.
It's great. I welcome that.
Very nice offer, thank you. Next, we are moving on to Jeff Hanley, who I understood was gonna be present in person.
He's gonna be transitioning to, virtual, so.
Oh, okay.
Yep.
So Jeff Hanley, if we can activate him so he can get on Zoom.
Yeah, thank you very much. I truly appreciate this and opportunity to present to all of you. And I do wish I could have been there in person, but unfortunately I was unable to do so today. But my name is Jeff Hanley, I'm the Executive Director of the Commonwealth Prevention Alliance, or CPA. We are a statewide nonprofit organization with a core value to support drug and alcohol prevention professionals, organizations, and coalitions throughout Pennsylvania. I was one of those high school youth who was surrounded by what we in prevention call protective factors when I was growing up. My friends didn't use substances, they didn't drink. It wasn't part of the culture environment of my family. When in school, I played sports, which were really important to my friends and I. And in the community, our friends' parents looked out for us, community members looked out for us. I had that protection, which really enabled me to be able to thrive at a younger age. However, when I went to college, all of that changed, and I lost all those protective factors and found out that a guy from a small hometown in Mercer County could become more socially acceptable, have more friends, be invited to all the parties if I was drinking. And I spent the next 10 years of my life really misusing alcohol, particularly on weekends. That really impacted who I was as a college student and as a young adult. And one thing that really drove me or drives the work that I continue to do now is that when I was in college, I lost those protective factors, but I didn't have those skills to back me up, the resiliency, the coping, the emotional support, the ability to communicate with a trusted adult. Those are skills that really are implanted at young ages through prevention programming. And that's what I really wanted to talk about today. And here, my goal really is pretty simple: to show why the opioid settlement dollars should be spent on prevention programs that are proven to work, that are effective or evidence-based. These dollars are specifically and promoted in prevention in Exhibit E, and they provide a once-in-a-generation opportunity to make a lasting impact on the health and future of our youth. I want to just consider just a couple real quick pieces of evidence because it's so telling. Youth exposed in one specific prevention program have better outcomes in alcohol use, school behavior, and employment. Remarkably, the children of these youth also showed improvements in behavior, academic performance, and substance use. The youth of the parents that were in that program when they were youth. Another program, the Communities That Care, was an evidence-based community prevention program mentioned in Exhibit E, found that young adults from participating communities that care reported great abstinence from substances and a 20% improvement in college completion. Programs like this, programs like Strengthening Families, Life Skills, Girls on the Run, The Incredible Years, Second Step, and others share common research-based features. They have evidence-based curriculum, interactive teaching and skill building, family and community involvement, evaluation, long-term engagement, and are age appropriate. And most importantly, timing matters. If a young person initiates substance use under the age of 21, there's a 1 in 4 chance of developing a substance use disorder. If they start at 21 or older, there's only a 1 in 25 chance. Prevention works because it helps you delay or avoid initiation altogether. But what doesn't work in prevention? And I would like the trust and counties to really consider this, because I looked at the spreadsheet and I look at the different counties that say they're doing prevention, but I don't know really what that means. And not everyone can do prevention. Effective prevention strategies require training, planning, and an understanding of evidence-based approaches. Well-meaning efforts alone are not enough. One-time presentations, assemblies, or classroom talks rarely build skills, change attitudes, or reduce substance use. They often rely on fear-based messaging, information-only approaches which aren't effective, or personal testimonies that do not resonate with youth. However, what does work in prevention are effective prevention. Effective prevention follows specific principles like using evidence-based strategies, invest in long-term approaches. There are no quick fixes in prevention. Coordinate multiple strategies across domains, working with families, school, community, and addressing policies that impact our communities. And then, of course, engage in those communities. If you're working with youth and you're implementing a program in a school district, but you're not including youth in that program, in planning of that program, then you really need to reconsider that, because they need to be involved in every aspect of the process. And most importantly, like, why prevention? Prevention is different than other sectors because it addresses the root causes before problems emerge. While some risk and protective factors that I talked about earlier overlap with other sectors, prevention uniquely targets access and availability of substances, community norms, social norms, perception of risk and harm, parent attitudes, peer attitudes. And by focusing on these factors, prevention builds resilience and equips youth and families with skills to make healthier choices.
Yeah.
So really,
That is the 5 minutes, if you could wrap it.
yeah, certainly. And Pennsylvania has the infrastructure, expertise, and evidence to really make these dollars count. Let's invest in prevention, and Commonwealth Prevention Alliance is here to help any county or community use the settlement dollars to fund prevention in your community. So I thank you very much for having me. I appreciate your time.
Thank you, Jeff, and I would note, and many of the trustees will remember, we did have a informational meeting of the trust, kind of a board retreat, and Jeff was kind enough to come in and speak to us for 45 minutes to an hour and present his, it was very, very helpful. So thank you, Jeff.
Thank you.
Next is Mary Ann Sininsky.
Sinisi.
Sinisi.
And I'm bringing Sean along with me because he cannot be here today. This is why the money is here. I don't really have anything planned. I have not anything to talk about, but just sitting here listening today, I hear the word evidence-based so many times, it makes me want to throw up, because the evidence that my single county authority and the facilities shoved down our throats was tough love, incarceration, substance use first, trauma second. Well, that evidence killed my child. So I don't want to go by evidence-based. I want to go by science-based. And when you said earlier today that the best resource is the single county authority, maybe in some, it might be, but in other ones, not so much. We are shut out as parents when this money was fought for my child and every other child that was lost, or husband or wife. So for us to be turned away for suggestions or to sit at a committee is pretty gut-wrenching, really. So you can spend the money how you choose while we just sit back and watch. No say. And we can't even apply for it because most of us don't have the luxury of having staff. So if I had a good single county authority, I would say that maybe they would help the community get the money, the nonprofits, the parents, the boots on the ground. They're the ones that have a right to use the money and say how the money goes. If you have a committee formed in your county and everybody on that committee is the one that's applying and getting the money, how does that seem justified to any parent that's in that community? It's not. So I'm tired of being shut out. I had to make a 2-hour drive to be here. I came to another one before. I still do not feel heard. If it took me 2 years in my county to get a committee, but guess who's not on it? The person that speaks the truth. and is not afraid to speak the truth. But it's real easy to label us as grieving parents, because that's all we are, right? We couldn't have any useful information to help, could we? Well, I'm gonna say we do. It might not be what you call evidence-based, and we might not have the education that some of you do, but we have lived experience. And we lived some horrific things. The day my child died, we weren't even allowed to see him. Nobody offered us the opportunity to see my child. So I had to fight for a year from UPMC Mercy to find out who identified my child. Now, if that happened from a death from cancer, that would never. I had another child that lived there, was at the hospital and helped them identify who he was. Because of 45 minutes of working on my child in a McDonald's bathroom, 6 police officers, and nobody can take his ID out of his wallet and say who it was when he went to the hospital. So when my other son was notified by Facebook by somebody that he was there, he went, and that hospital denied him the right to see him. So not one family member ever identified Sean. So he died like a piece of garbage and nobody cared. The family was shut out. So if you wonder why parents are angry, because this stuff happens, I'm certainly not the only one. It happens all the time. So I think it's time that you start looking at us as a valuable resource. Some of us might know figures and other programs, the other ones don't, but we all have lived experience and we have something to bring to the table. So I think it's time that we are included. Instead of saying the counties get to decide, half of them, my county decides prevention should be the way to go. Well, you can't, I couldn't prevent away everything that happened to Sean. I couldn't prevent the sexual abuse that caused him the trauma.
1 minute.
Or I would have. So what are we gonna do different with this trust and with this money before it's all blown on things that you all think is valuable? Because I certainly think my child's time on this planet was valuable, and he could be here today had things been done different. I know that for a fact. He was denied being put on MAT, and now the evidence has changed. So how do you think that feels to a parent when all of a sudden we flip the evidence and say trauma-informed care, but yet I was told, nope, you gotta work on that addiction first. So stop acting like you have all the answers and start listening to the people that are on the streets and that have the family members struggling. Thank you.
Thank you very much for your time, and I'm sure I speak for everybody. We're very sorry for your loss. I'm
Thank
sure you know. Okay, move on to the next person, Carla Sponsky, who I believe was the first.
She on Zoom.
Oh, so by Zoom, okay. Carla, the floor is yours.
Great, thank you. Good afternoon, everybody. Oh, I have to take a moment after listening to Mary Ann. My name is Carla Safransky, and I'm the director of Pennsylvania Harm Reduction Network. And just so you know, today I'm representing advocates from across the Commonwealth. I'm not just here representing myself, I am representing families, people who use drugs, providers who are in this harm reduction organizations, and all of our stakeholders. I'm a person with lived experience from an opioid use disorder and in recovery. I am also a person that has buried way too many people, including my sister Eileen and my late fiance Ted. PA Harm Reduction Network is an organization, and we serve to build power across Pennsylvania to end overdose deaths, drug use related incarceration, and to build power across Pennsylvania, more so to stop the spread of HIV, HCV, and all the other complications and harms associated with drug use. We do that by collaboration with our stakeholders, advocacy, but most importantly, public education in real time, information sharing, and supporting access to resources and supplies. PARM started in 2021. We have gone through the state, and we have brought people along with us today, like people like Mary Ann, families who are grieving and in a lot of pain and who demand action. Here's some of the things that I want to talk about today, and I know I'm limited on time, so I'll try to speed it up, but I want to make sure that everybody can hear me and understand. Pennsylvania has received more than 2 billion in opioid settlement dollars, but only about 390 million have been distributed, and that's just a fraction of what has been spent. Instead, too much money has gone to wasteful programs. Around 2 million has gone to drug disposal bags that end up in junk drawers or thrown out. We are not in a prescription overdose crisis. We are in a illicit drug crisis with our fentanyl and contaminated drug supply with sedatives. Too much has gone to other wasteful programs such as purchasing fentanyl testing strips, xylazine testing strips, and naloxone at retail prices, when bulk procurement could easily stretch every single one of those dollars. I'm tired of also seeing glossary awareness campaigns with no evidence that they actually save lives. I see an awareness campaign for every county. That is baffling to me that there's no evidence base that these tools are actually working or creating prevention methods. Meanwhile, the most effective tools out there that are evidence-based and backed by research and science, such as street outreach, naloxone distribution, drug checking programs, critical public education, and syringe service programs remain underfunded and, quite frankly, ignored. And here's the worst part: we don't even know how programs are being approved through the trust and what tools are being used. So we question what tools are being used, what criteria, and who is scoring them. There's no published rubric that I can find, and there's no published process, no accountability. And when that happens, typically there's waste, and waste thrives in secrecy. We know that other states are doing better, and we wanted to point that out to you today. In North Carolina, before a single dollar goes out, every dollar must file a local spending authorization report with the strategy, amount, and duration as it's publicly posted so communities can hold leadership accountable. In Massachusetts and Virginia, there's a standard, even clearer way of publishing a scoring rubric for every grant line, including criteria and weights, and post-award memos showing how finalists are scored.
1 minute left, Carla.
Thank you. There's proven tools that are out there and that we know that worked. Art Halsley presented one to you, but we need accountability and we need effectiveness of programming, and that is my main concern today. It is not okay that we are spending $70,000 on speakers, $178,000 on campaigns of awareness that we have no idea what's happening here. We need lived experience at the table. And here's what we want: full transparency. We want public accountability, real inclusion that guarantees compensated seats for people with lived experience at every decision-making table, proof of effectiveness that requires to justify funding, especially for campaigns and programs that look good on paper but do not deliver results, and direct funding for frontline nonprofits doing the work day to day that keeps people alive. We know what works. Pennsylvania saw a drop last year in overdose. That's proof that investing in real evidence-based programs and treatment saves lives. This is life or death, and every idle dollar is an obituary. Thank you.
You.
Thank you.
Next up is Commissioner Jeff Snyder, who is by Zoom.
Good afternoon. Thank you. Actually, I'm just here to learn and observe today, and I just thank the the board for allowing people to have this opportunity. So that's all I'm here for today, is just to listen and learn. So thank you.
Thank you. Appreciate it. Appreciate your input. Next up is Gail Gross Scott. By Zoom.
Hello. Thank you for inviting me here today. I'm Gail Grove Scott. I'm a mother of 5. I'm a public health policy researcher, an advocate. I have a master's in public health, and I'm a doctoral candidate in health policy at St. Joseph's University. I'm representing an independent organization that I own called Health Policy Network in Lancaster, and I welcome feedback. You can email me at gail@healthpolicynetwork.com. I have expertise on opioid prevention, opioid marketing, and settlements with pharma, not just from my academic studies, but I have lived experience. I was a pharmaceutical rep for 16 years, and I sold opioids for pain management and addiction before changing careers to work in public health research and advocacy. I became a whistleblower that helped federal and state governments get back billions for taxpayers in a False Claims Act case. Then I helped the federal government investigate Purdue Pharma. I served as a fact witness to a grand jury. This is personal to me, how these funds are being spent. I've presented peer-reviewed research nationally on access to medications for opioid use disorder. I've presented on pharmacist provision of addiction medications. My dissertation research is on the public health impacts of drug company promotion of addiction medication. I have some expertise to offer this group, but the choices this body has made under Chairman Van Kirk's leadership have baffled me. The early secrecy of this board's meetings have been well documented. The board's leadership has been dismissive of the Sunshine Act despite claiming that they follow it. You hired multiple vendors and contracted for professional services without putting out a public request for proposals or a bid process. Your transparency got a rough start in our view. But you've been doing better in some ways. I showed up at your first public meeting disappointed that I was only allowed to deserve. I showed up at several later meetings. I was disappointed to hear Chairman Van Kirk publicly complain at one of those meetings about having to rent space for the public to attend at all. You don't see the value in our expertise and our lived experience? The argument that the only role for public input is at the county level just simply does not hold water. Guess what? Many of those counties do not allow the public to be involved before they make a decision about where to spend or allocate their money. For example, Lancaster County, they followed your lead. They hold their work group meetings in secret, just like this group. Your working groups are wrestling with difficult decisions about what spending is approved. You've talked about that at every board meeting. Exhibit E's instructions have required you to make interpretations. You have been guiding the allocations made by the 67 counties, and they begged you for more guidance. Yet you have made the choice to oppose and litigate requests for transparency instead of just being transparent, instead of allowing us to attend and have dialogue and provide input in the meetings where you are making these important decisions in real time. You made a decision to treat us as adversaries instead of as collaborators. I don't understand it. What do you have to hide that required this level of secrecy? I mean, what? Senator Greg Rothman had the courage to say that keeping the public from attending your working group meetings was wrong. There are new board members here today. I ask you to make a fresh start, to make different decisions going forward. Sunshine laws and the public right to know laws set minimum requirements. They do not restrict the amount of public disclosure you are allowed to do. You chose secrecy. It was not forced on you. You're choosing to spend money in court to maintain that secrecy unnecessarily. You chose to change the language of the court order to clarify that you're not a public agency or a judicial agency. Why was that necessary? Why is it necessary to oppose perfectly reasonable right to know requests from journalists? Senator Greg Rothman also questioned in February why you're spending huge sums on legal services, a major portion of the $1.5 million in administrative costs. Chairman Van Kirk defended it as a good value, discounted rates within your budget. Chairman Van Kirk, respectfully, it's time to stop gaslighting us. Every dollar earned from that interest could be going towards programs saving lives. I think you've lost sight of who your client is here. You are representing me. You are representing the public to see that this unique and finite stream of funds is not wasted. You can divert the money you're spending on legal battles to hide documents and block public input to the counties who need funds. At the December meeting or the next work group or subcommittee meeting, I asked this board to make a motion to allow public input, not only public comment periods at the end, but input before voting, to get input from the experts who can help you with the complex decisions you are making before you vote. That public dialogue that is sadly missing today. My lived experience includes being the parent of a child in sustained recovery. My child is alive today due to access to overdose prevention services.
We'll get back to you on many of the items that you raised. Thank you. Next up is Sharon White, please, by Zoom.
Hello, good afternoon. I concur with many of the messages I've heard before with the presentations and the speakers of today. I would like to express my gratitude for the opportunity to address the Opiate Misuse Addiction Abatement Board and trustees, and so many other people that are making a difference to save lives today. I am Sharon White, a resident of Delaware County, a business owner, a person with lived experiences in supporting loved ones with OUD. My passion and interest in speaking here today is motivated by my beloved son, Lloyd Andrew White's long and courageous journey with opiate use disorder and his ultimate passing from a preventable overdose. Lloyd and my family were exposed to extensive stigma, harmful practices, and systems by both professionals and community in his efforts to achieve wellness. Unlike my daughter, who was diagnosed with brain cancer, we were surrounded by competent, compassionate medical team and a robust 5-year continuum of care for a holistic approach for her healing. Thank God she is a cancer thriver today and is living her best life. I feel confident had my son received this type of care, he would have had a greater chance of surviving OUD, a devastating chronic disease. After 12 years of being on the front lines of this devastating public health crisis, I have witnessed firsthand the positive impact the opiate settlement funds are having on the lives of individuals, families, and communities who are valiantly doing their best to obtain a place of wellness. Together, we have made tremendous progress. Nevertheless, as we've seen here today, and likely moving forward, we still have a great deal of work to do to accomplish our continuum goals. According to the Center of the CDC controlled publications on May 16, 2025, new data showed that drug overdose deaths in the United States decreased from an estimated 110,037 in 2023 to 80,391 in 2024. The growing impact of billions of dollars in opiate lawsuit settlement money has been named as one of the factors in reducing overdose deaths. These proactive actions are saving lives, and it is imperative that we continue the impetus of accountability and provide best practices to continue this path forward, partnering with individuals having lived experiences, experts in the field, government officials, and community for optimal positive outcomes. We have lost a generation of loving, young, kind, and talented individuals in our communities and families. We have the opportunity and responsibility today to allocate these funds to assist in saving the lives of the next generation. It is imperative that we maintain accountability, data collection, invest in best practices, preventable measures, evidence-based programs, and fill the large gaps to develop a continuum of care that saves lives. Thank you for your time and consideration. And once again, I appreciate all the people that are working so hard to make a difference in the lives of the next generation. Thank you.
Thank you very much, Sharon. Appreciate it. Appreciate your comments. Next person up is Susan Osterman.
Hi. Thank you for allowing me to speak. I come here first as a grieving mother. I lost my son Tyler in 2020 as a direct result of poor, potentially criminal decisions made by county and state officials. Those same officials are deciding where this money goes. That's kind of hard for me to wrap my head around, knowing the history of their decisions. I was appointed to my county advisory committee after there were complaints that there was nobody with lived experience on the board, on the committee. The whole thing was performative. The plan was already written. I was the only one who asked any questions. And when I voted against the plan, I was never invited back. In fact, I thought that they had stopped meeting because I just didn't hear anything. But it turned out a year later, I found out that they were. I did a records request and found that they stopped taking minutes after the same meeting that I was not invited to. It's hugely problematic. They don't want to hear from us. We're pinned as angry moms, like Marianne said. We're not. We're angry because no one's listening. We have enormous amounts of information to share. We eat, sleep, and breathe saving lives because we know the consequences and we have answers. One of the most painful parts of losing a child to an overdose is you have crystal clear hindsight. You can see what they needed. You don't see it when you're in it because you're living in a traumatic state. But you can look back and you know. But nobody wants to hear from us because they don't like the truth. It's all like, we're really nice people. Anyway, so in my county's initial plan, they had allocated funds for bereavement support and they never followed up. When my son's best friend died in 2023, I took on the role of starting a peer grief network because we had no services to offer them. Philadelphia is the only place I know of that offers free bereavement support for overdose families. And it's an amazing program. So I started this program. My county still will not fund it. They just agreed to give me up to $25,000 for reimbursable expenses. In this work, I've done some surveys. Out of 99 families, this is some data that I have. 74% faced financial barriers to having a funeral that they wanted for their loved one, their child. These are all mothers. 12% couldn't afford one at all. 80% said that the bereavement leave from work was inadequate, usually less than 5 days. 43% have stopped working after their loss, and nearly a third of them were terminated by their employer because of their grief. 5% have lost their homes, 5% have declared bankruptcy. 81% have depleted their retirement caring for their grandchildren or paying for treatment and funerals. Only 2% have received support from opioid settlement funds. These are the realities that we face while hundreds of $millions are sitting there not being spent. So it's really hard to swallow when I hear people giving sighs of relief that they have more time to spend money while I'm watching families being destroyed financially because of these losses. In fact, I learned a few minutes ago that Marianne tried to have lunch there and she was stopped and told that the food was only for committee members. A grieving mom drove 2 hours to be there today and she wasn't fed. You hold a public forum and you don't feed the public? That's our money. Family members and people with lived experience need to be at the table. These decisions wouldn't be so hard. You wouldn't be trying to figure out how to spend the money, or the counties wouldn't, because they know where it needs to go. And according to Section 5C6 of the trust order, there's 7 opportunities to have a family member or a person with living experience serve on your board, but nobody's doing that. We have policymakers making these decisions. And truly, every overdose death is a policy failure. These are all preventable deaths.
Susan, 1 minute to go, but could you also identify the county that you're referring to in your remarks?
Bucks County is where I'm from. I asked to screen share in advance so I could share a short video to remind you all of who died for these funds, but I was denied that request. There's a person who had his personal information shared on one of your meetings from 2023, and it's still there. It's on for 15 minutes. It's on the screen, his phone number, his personal story, and he's requested you remove it repeatedly and it won't come down. Then he tried to get your address because he wanted to file a complaint, and the trust administrator refused to give the street address. This is transparency. You've received $390 million and spent 83 million. There's 254 million sitting there. 7 million of it at least is expired. Where's the consequences? Why isn't this money being spent? Is it the interest because you can do whatever you want? Because that's blood money too. Now I'll wrap up because I can't deal with being cut off. Please consider maybe having these closer, have multiple in the evening so more people can attend. Thank you.
Thank you. Thank you. The final speaker, and I hope that she is able to wrap up her other commitments and join us, is Kathleen Strain.
I'm here. Thank you for having me. Hopefully I can get everything I have to say in. I'm gonna probably speak quickly. I have a lot to say. First, thank you for the opportunity to speak with you today. As you mentioned, I'm Kathy Strain. I've been deeply involved in negotiating and securing these funds for the state by serving on official and ad hoc committees for opioid litigation. And I also serve on a national opioid trust and have seen firsthand the impact that dedicated resources have on our communities. While I also work professionally in this space, today I am speaking as a family member, a Berks County parent of a few amazing adult children in recovery, and a person who has lost more than one family member to an opioid overdose. I've spent the last 3 decades helping to raise the children left behind in the opioid crisis, including my nephew Tommy, who came to live with me as a young boy after his father died from an opioid overdose. At the age of 27, our Tommy died that same tragic death, an opioid overdose. Thomas died the week after his program told him that using doctor-prescribed medication was not recovery, that the only route to recovery was complete abstinence. I could tell countless stories like mine from the thousands of families that I have met on my journeys, families whose horror story is the reality that these dollars exist. However, today I'm here to emphasize the importance of using these resources to reach those most in need. There's several areas. I'm going to cover a few. First, we should be allocating dollars for evidence-based family approaches. When we invest in families, we're not just providing immediate relief, we are laying the foundation for long-term recovery. Evidence has shown time after time that family support is crucial in helping loved ones to navigate the recovery journey. Evidence-based family approaches empower parents and caregivers with the tools and knowledge that they need to support themselves and their loved ones effectively on every step of that journey. These tools enable family members to interact with their loved ones in healthier ways. Too often, families are given bad information and even blamed for their loved one's addiction. We must recognize and invest in families as part of the solution. Several years ago, I experienced the life-changing impact of a DDAP grant program that offered an evidence-based training for families. At that time, I was in the throes of my children's addiction, and this program provided me with the support and knowledge that I needed and helped me to motivate my loved ones to seek a treatment program that worked for them. It was a pivotal moment for my family, and I truly credit this program with not only giving me the tools that I have used every day since, but also with changing the entire trajectory for my family. Well, my surviving kids, I should say. Research proves that when empowered families are involved, outcomes for people who use drugs are better. Secondly, allocating funding for the children. There are very little resources, really no resources available for the children left behind due to their parents' active addiction, incarceration, or death. These kids are at risk for addiction themselves, both from the genetic predisposition and the trauma of navigating life without one or both of their parents. Our classrooms have been filling up with these children for years, yet their very specific needs are continuously overlooked. I have watched firsthand the generational curse of addiction, and I know that we need to head upstream and fund evidence-based prevention programs that are geared specifically to this population and their caregivers. We should also be using dollars to fund programs that truly meet people where they are at. Programs that recognize that recovery is achieved once a person's substance use is no longer interfering with their life, not when a person is abstinent. Putting dollars in only into abstinence-based treatment is a disservice to the community. And to wrap up, I'd like to ask you a few questions. If you are truly committed to making a difference, why isn't there full transparency on the use of every single opioid dollar in Pennsylvania? This money was earned on the backs of our loved ones, and we have a right to know how it is used. And if we really wanted to discuss the allocation of these funds with the public, if you really, really want to discuss this with the public, why isn't this group primarily composed of community members with lived experience? We should ensure that those who have firsthand experience with this crisis have a significant say. They know what works and what doesn't. Their experiences are the reason we are here today, and they should play a crucial role in deciding how these funds are distributed. From my view, it is extremely problematic that the majority of these seats are filled with elected and appointed officials rather than community members, and that there is also a lack of transparency on the use of these funds. Thank you for your time, and you know how to reach me if you want more information.
Thank you very, very much. Appreciate it. Appreciate all of the input that we received from all of the speakers, and I can tell you, we heard you. And we will be taking everything into account. We will have future sessions like this in order to hear from you, and appreciate all of your the public listening session is over, and the meeting will be adjourned. Thank you.